Okay, before I enter the patient's room, I'm just going to be checking their chart to make sure that I'm going into the patient's room with the information that I need, the supplies that I need, why they're here, everything like that. This patient, yes, this patient is here for pneumonia but had an incision, and so I am coming in to do wound care. So I'm going to come in and I'm going to knock on the door and I'm going to introduce myself. Hi, my name is Drew. I am a student nurse and I'm going to be helping you today. Could you just identify your name and your date of birth? While he's saying his name and date of birth, I'm just going to be washing my hands, and then I'm going to check his bracelet to make sure that that matches with the computer, and that matches, so that's great. I'm going to be putting on gloves before we start the procedure. And I am going to bring my supplies over here. And I'm going to bring a garbage can over here so that I can have that where I need that. And then I'm going to close the curtain for privacy. And then I'm going to explain what we're doing to the patient first. So I'm going to say that I'm coming in to check on their wound for their incision that they had, and that I'm going to be taking off the bandage, looking at it, assessing it, cleaning it, and putting new bandage on. And I am going to ask him what their pain is. It says that their pain had been a 3 out of 10. I'm just going to ask them how their pain is, if they need medication before the procedure. And if they did need medication, then we would give them medication, leave for 30 minutes, and come back to continue and resume the procedure. So now I'm just going to raise the bed to working height and a comfortable position for them. Okay, and then I'm just going to make sure that there is a pad underneath them so that if anything drains, that it will go onto the pad. And I'm just going to pull the blankets back and pull up the gown so that they still have privacy, but that we can work on the wound, the incision. So I'm just going to assess for any drains or tubes or anything like that. It looks like they do have a catheter. They have an IV. Their chart said that they were on oxygen. So we just want to be aware of these things so that they don't get in the way, we don't mess anything up. And then I'm going to be taking the bandage off. This is very important because we don't want to tear the skin that's around it. So if it was difficult to take the bandage off, we could use like alcohol wipe or saline. And but as of right now, I'm going to try and just pull up the corner and hold the skin and just pull off the corners first, and then I'll take the bandage off. Okay, so now I'm going to take the bandage off and I'm going to take a look at it. They had mentioned in the chart that there was serosanguinous drainage, so we just want to make sure of what that's looking like. It doesn't look like there's any serosanguinous drainage or anything, but we want to continue to monitor that in case that there was. And I'm just going to throw this away. There is gauze in here, so I'm going to take this out and I'm going to throw this away as well. I'm going to continue to assess for the color. There it does look like it's red. There could be a little bit of swelling. And then I'm going to also be looking for like stitches or staples to see if there's anything like that. Doesn't look like there is. And so now we are just going to measure the wound. I'm going to come over here and I'm going to grab a sterile measuring stick, and I am going to measure this, the length, and then I would measure the width, and I would measure the depth. Okay, and I would document that so we can keep an eye on the incision, and I'm going to throw that away. Now that we've looked at all of this, it is time to clean. So I'm gonna take these gloves off, and I do need to wash my hands, so I'm gonna hand sanitize. And I'm going to set up my sterile fill now. Okay, so now I'm going to take my supplies and I'm gonna open it away from me, and I'm gonna throw that away. Okay, I'm gonna get my gloves out. I'm gonna open. Okay. I'm gonna grab some new gloves. I'm gonna open these gloves up, and I'm gonna plop it on the table, and I'm gonna throw this away. And I'm gonna open these up. And I just wanna make sure that I keep this so that it stays open. And I'm gonna open this up. Okay, I'm gonna put my right glove on first. Then I'm gonna take my left glove. And because this hand is sterile, I'm gonna reach underneath here, and I'm gonna pull this up over my hand. Okay, now I have my gloves on, so I'm gonna wipe this off, and I'm gonna get my field set up. So I'm gonna pull this out so it doesn't touch the table, and I'm gonna set this out, and I'm gonna get out everything that I need. So I'm gonna get out this red bag. I'm gonna throw this away. Everything that I do to clean the wound, I will be putting in this bag. So I'm gonna open this up, and I'm gonna set it on the bed so that I have easy access to it. I'm gonna continue to pull everything out. We have this measuring supply that we can use if we need to measure it. We have everything that we need in here. Okay, there's so many different ways that you can clean a wound, and it really just depends on the patient. So you could irrigate it, you could dump the saline on the gauze, but for now, we are gonna be dumping it into our container. So I'm just gonna open this up. I'm gonna throw this away, and I'm gonna dump this in here. Okay, now I'm going to get my gauze. I'm gonna use 1 piece per swipe. So I'm gonna get this wet, and then I'm going to clean from top to bottom. So I'm gonna clean this, and I'm gonna throw that away. Then I'm gonna get a new one. And I'm gonna clean from top to bottom. Throw it away. Get a new one. Clean from top to bottom. Okay, and then I'm gonna take a new one of these, and I'm going to dry around this. I'm gonna dab it. I'm gonna take another one, and I'm gonna dab it. Okay, perfect. Now for this order, they were asked that we put gauze inside of the incision inside. So I'm going to take this piece of gauze, these pieces of gauze, and I'm going to stuff this wound. Okay, now that I have done that, I am going to take this, and I'm going to place this over the wound. and you want to make sure that it covers 1 inch over it so that it is being covered. And now that it's covered, I'm going to take the tape and I'm going to tape this so it stays down. Okay. Now I'm just going to throw away everything that I used. Besides one thing. This little guy. Okay, now I'm just going to place that in here, and I'm going to take this and I'm going to throw this away as well. And I'm going to take my gloves off. And I'm going to wash my hands. And I'm going to put some new gloves on. Okay. I'm going to take my pen and I'm going to write the date and the time. And I'm going to stick this on this so that we can remember, so that when they come to change it again, they can know when it was placed. I'm going to set this on the floor until we take care of that. I'm going to put this back and make the patient comfortable. I'm just going to talk to the patient and ask them how they're feeling, how they're reacting to this incision, and let them know that they can talk to us. This patient did, on their chart, they had asked like what they can do at home to take care of this wound, and we just want to make sure that it stays clean and sterile, that we're changing the dressing when needed so that it stays without infection. And then we just want to make sure that we can keep track of the odor of it, purulent, if it has yellow drainage or the serosanguis that it was having. We just want to keep track of that. But if they don't have any more questions, then I'm just going to get them comfortable. I'm going to put down the table, or their bed, into the lowest position. And one thing that I did want to mention, that if they did have a drain, that we would need to clean around it, but they didn't have any drains or tubing or anything, so we didn't need to clean around that, as well as if they were ordered any creams or any medications to be put on the wound, but they weren't ordered any of that, but we would have done that if so. Now I'm just going to take this trash and I'm going to put this in here so that it all can be taken to be thrown away. And I'm just going to take my gloves off, throw my gloves away, and I'm just going to wash my hands, and we should be good.